She had insurance. Keeping it once she got sick proved to be a bitter joke. This sounds like a horrible nightmare.
It really is. By all medical odds, Cynthia Campbell should be dead. She says her health insurance company probably wishes she was dead.
What frustrated me so bad, I found that I have been able to rescue thousands of other people. Couldn't rescue my own wife.
That's saying a lot. Alan Campbell was a Marine pilot in Vietnam and flew during the war in Rhodesia. He also ran a humanitarian airlift in Mozambique and ultimately engineered the rescue of thousands of people during Rwanda's genocide.
We're a team, he and I. He's my great love.
Cynthia did humanitarian work in Africa, too. These photos are from a mercy flight to rescue an elderly woman trapped by the Liberian Civil War. She says she knew Alan was her soulmate when she saw him on TV talking about Rwanda. After 11 years of marriage, Cynthia and Alan say they're where they belong, together.
I'm so proud of her.
But their life together is now running on borrowed time.
I didn't have any symptoms. I worked on a Friday. I went into the emergency room on Monday, and that's how quickly it changed.
Cynthia, a registered nurse, was diagnosed with stage 4 cancer in July of 2006. She had major abdominal surgery and has undergone chemotherapy every 3 weeks since.
And I was working full-time.
That was full-time freelance at UC San Francisco Medical Center while she waited for a full-time position there. She bought a 1-year independent health insurance policy with Blue Shield of California. Alan says Cynthia's bills piled up while he fought with Blue Shield.
They first had to prove or disprove that my beloved wife did not have a condition prior to the insurance policy coming into effect.
Cynthia had 2 different types of cancer, and she says her doctors are surprised she's still alive. The couple says after 8 months and damage to their credit, Blue Shield finally began to pay. But when her policy expired, Blue Shield claimed her cancer is now a pre-existing condition. They won't cover Cynthia anymore, and neither will anyone else.
It was a process that started with disbelief and then slowly evolved into a deep, deep anger.
Cynthia and Alan started visiting the Blue Shield office with a bullhorn.
When Blue Shield wouldn't budge, the couple headed to Sacramento, where Cynthia addressed a Senate committee about her health insurance experience.
They didn't build the healthcare system. Nurses, doctors, people like me built the system. I feel like the insurance companies have evolved into something that is a leech.
So what does Blue Shield have to say for themselves? They tell us they're sorry they can no longer insure Cynthia, that they wish there was a law that required them to cover everybody. But they also say if they insure too many sick people, they can't compete with the rest of the industry, that they're working with lawmakers on a universal plan that would spread the risk evenly. Meantime, they won't do anything for people like Cynthia.
But while the politicians and insurers debate, Cynthia Campbell is dying. And she says most people are closer to her insurance catastrophe than they may think.
They're one illness away. One illness only.
Cynthia Campbell thinks her problems prove the insurance system violates the most basic principle of health care.
It's a sacred thing that healing is, and it has been corrupted now. In this country, it's being used in a way that the money changers were using the temple 2,000 years ago.
Since our interview, Cynthia Campbell has been diagnosed with a 3rd type of cancer. She has found group insurance after accepting a job with the state senate, but that doesn't happen for everybody. I get thousands of calls and emails a month. A good number of them involve medical insurance. So what can you do to avoid a situation like Cynthia's?
The most immediate way to avoid a nightmare if you are sick is to be persistent with your insurer. Call and write them. Don't let them treat you like a voiceless account number. Keep track of who you spoke with, when, and about what. Try to find a single contact who you can get familiar with your case. Know what's in your policy, what's covered, and for how long. And finally, if you have group coverage, do what you can to keep it.
Now, if you do have insurance and your claim has been denied, you can take on the insurance company for free. Tomorrow night, we will show you how. In fact, we helped one woman beat the system.